So now we're going to focus our attention a little bit more inferiorly. We're going to talk about the bones of the leg. And that would consist of the tibia, which I have in my hand, and also the fibula. Now the tibia, of course, is the bone that's going to articulate with the femur. And if we get a closer look, this is the most superior aspect. You can see these shiny areas in here. These are articulating surfaces with the femoral condyles. Now we also call these prominences of the tibia condyles as well. So we have a medial side and a lateral side. Now how the heck do I know that this is the medial condyle versus being the lateral condyle over here? Well, what I can do is I can actually just look posteriorly and inferiorly rather, and see this big bump down here at the bottom. And this is called our medial malleolus. You can actually feel this on the medial aspect of your ankle. This is one of the larger bony prominences that we'll talk about. So I know that this is the medial side, so therefore this has to be the medial condyle of the tibia. And then of course the lateral condyle of the tibia as well. So in between, if you can appreciate these two little horn-like structures that are right in between our articular surfaces for the femur, and we call these little spiny-like projections the intercondylar eminence. Intercondylar eminence. They also are called the intercondylar spine as well. Now why we care about these bumps, particularly in sports we care about them, because this is exactly where the ACL is going to insert right into this particular area in between the condyles. So this is your intercondylar eminence. And if we continue looking at the anterior aspect, I'm going to get a little bit closer here. We see this particular area, because it's flattened, we call the tibial plateau. And we go down to this bumpy-like projection, and if I turn this here, so this is the anterior surface, you can see this bump that arises. We call this the tibial tuberosity. And this is significant because the patellar ligament will attach there, and that of course is going to attach really our extensor mechanism, or our quadricep muscles, to the tibia. If we continue along this anterior aspect, you can see a very sharp, almost like edge to this. So the tibia has a almost like a triangular type of an appearance, with really one of the apexes pointed anteriorly, and we call that the crest. And it's right along the anterior shaft of the tibia. If we continue down, as we mentioned, we already talked about the medial malleolus, and then this is going to form articular surfaces for our talus, which is going to become our really our key component and our weight-bearing component of our ankle joint. We also have an interosseous border. So if we're thinking about this as the triangle, we are going to have the fibula that's going to be just lateral to this tibia. So in between those two bones will form an interosseous membrane, and so we call this the interosseous border right in this region here. You can see that ridge coming right through. So we already kind of talked a little bit about the fibula, but let's look a little bit more specifically at the fibula. And the fibula can be a little bit tricky to identify and look at. So I don't know how well you can appreciate this. This would be the most inferior aspect. So this would be what I'm pointing to here is our lateral malleolus. And if I can continue up along here, you can see the most superior aspect we call the head of the fibula, or the fibular head. Now, a couple points that we really want to pay attention to, and I say points literally because if you can appreciate this, let me zoom in a little bit further. on the head of the fibula, there's this projection. We call this the apex or the styloid of the fibula. So that's going to be a key landmark to know which is the head versus which is the lateral malleolus, because it's a lot more pronounced. The fibula also has a neck and then a shaft as well. Now, the fibula, when you get into the lab, you're going to appreciate that it's a lot pointier than some of the other bony structures that we've talked about. The most pronounced area is along the shaft here. It's really actually pretty pointy, and that's our anterior border. Okay, so our anterior border here, and that's going to help orient us into whether this is a left or a right fibula. Another key point to know as far as determining right and left fibulas is the points are always going to be in the back. So our styloid off the head is going to be pointed almost in a more posterior direction, as will the most inferior aspect of the lateral malleolus. That too will be pointed posteriorly. Now we have some articulation spots as well. We have an articulation for connection with the tibia on the head here. So this is just inferior and medial and slightly anterior to that styloid process. And then on the lateral aspect we have a facet as well to articulate with the tibia. And then this little area right in here, this little groove, we call this the fossa of the lateral malleolus. So this is going to have some articulation and some significance as well with some of the structures that we'll talk about primarily in the springtime. So let's look at how these two piece together. So I have my right tibia, and I have what I think is my right fibula, and you can see, especially if I look posteriorly, how nicely they can fit together. Now let me zoom in here. It's going to be hard to appreciate, but you can see these articulations fit pretty nicely together. So here's my anterior aspect, which you're looking at. There's a lateral aspect and now a posterior aspect. You can see the most pointy projections are in the posterior aspect of the leg.